Hi, I'm Lauren Ryall-Waite and I'm the Curator here at the Thackray Medical Museum in Leeds.
And I'm James Drife. I'm a retired Professor of Obstetrics and Gynaecology, and I helped to think up this design here, this display that we're going to talk about.
So we're just having another look at this installation, and the first thing I can see on it is that it's defined by maternal mortality rate date between 1880 to 2001. I've just been thinking, we don't actually discuss what maternal mortality means anywhere else in the galleries. And as a curator, I take that as meaning that the mother has died, but often it means that the baby has died also. But I'm not sure we've explicitly explained that anywhere to any of our audiences, actually.
That's right, and the short answer is that maternal mortality actually pretty well always involves the death of the baby as well as the mother. Either the baby has died before or it's been delivered prematurely or something. So it's kind of, it does happen that the baby can survive and then the mother dies after that. So it's not, the two are not always linked, but certainly back in the old days they often were. There are some famous people like Eric Sykes, the comedian, who's actually, I remember well, whose mother died when she had her, just after she gave birth to him. And very touchingly, when he was in his 80s, he said that I think of her every day, which is a very sad kind of thing. So yeah, some babies are left without a mother. But the other thing about the technical meaning of the rate is it's the number of deaths per so many pregnancies. And it used to be measured per 1,000 pregnancies, but it's now so, thankfully, so rare that you measure it per 10,000 pregnancies. So it's become a lot lower, obviously, as a display show.
So this installation then is talking about quite serious things in a very visual way.
So this is a graph of maternal mortality, the chances of dying in childbirth, which were really high during the 19th century. And the top of the graph represents the figure. There's a graph on the glass that you can hardly see. And behind it, these figures which show there were spikes when there was outbreaks of infection. But basically it kind of changed very little up till 1935, just 12 years before I was born. And then it came down very dramatically during the Second World War, and it's remained low and even lower as time has passed, although the figures don't really show the variation in recent time. And we thought, when the exhibition, which is now in a corridor in the Thackray Medical Museum, when it was first thought about, we thought there's an important message to get across. Childbirth is much safer, and certain things have been done to make it safer, like the invention of antibiotics and so on, which are marked on the glass outside here. But coming back and revisiting it again after 20 years, I'm really not sure if it does what we wanted it to do to begin with. An artist suggested having the figures behind the glass, and they represent a certain number of deaths, but they attract the eye, these ceramic figures, and they sort of distract, I think, in some way from the main message. So I'd be really interested to know what Lauren thinks about it as a means of informing people visiting the museum.
So I think our museum visitors don't really appreciate that this discusses risk. Certainly not risk in childbirth. When we've been in the galleries and watched visitors interacting with this display, first of all, it is very much the appearance of the tummies that people see, first of all, especially if there's families there, because their tummies are naked as well. And the fact that they've got no heads on does detract somewhat from the message. I'm not sure that risk is a concept we can get across in a simple display like this. I mean, it looks beautifully artistic, but is risk too abstract for museum visitors? And certainly is risk in childbirth, with so many factors affecting it, something that's too big that you can do in one display, although it's quite a long display. We've certainly chosen to talk about certain aspects around key inventions and discoveries that have affected maternal mortality for the better. But it's not until you actually go to this tiny point here that it says what one figure represents. And I think I'd really struggle to understand one maternal death in 400 births. with all of these bellies here, I think I would really struggle to quantify that in my head.
To be honest, I don't think it's actually what they do represent. I think that label is not terribly accurate, so that doesn't help.
And that also shows that statistics change. So some 20 years ago, it went up to the year 2000, but we're now in 2017.
That's right.
And actually, it needs to continue in order to show a true representation and understand exactly where we are at the moment. So that's the trouble with statistics. If you place them in history, you need to have flexibility to show how it changes, which is quite difficult to do with this display.
Yeah. And somebody was asking, you know, what do these words on the screen mean? And this one particularly, which is at 1930, so the timing is there. But home deliveries under anaesthetics, and people that used to be that the doctor would turn up with a chloroform mask, anaesthetise the woman and deliver the baby. But was that commonplace or was that rather unusual? I don't really quite know. So there's lots of debatable things about it which are not easy to explain even to somebody who's supposed to know about it.
I think as well a lot of our visitors have turned to the media to find out about how some of these huge changes in maternal mortality have happened. And you've only got to think about the success of TV shows like Call the Midwife, and think about how people now see the history of midwifery and home births, particularly when you mention home births. So I'm not sure whether or not their image of it really relates to this graph. Are the deaths they're seeing on television, I appreciate fictional, but supposedly founded in history. Are they relating to this as an abstract view of risk, and do they represent one of these torsos on the chart?
I think it's a really important point that what you relate something like this to is what you've already seen. And Call the Midwife's very carefully researched, so they actually document some of the advances. And so if you have something like, I suppose, I don't know, I haven't seen it, but if you go back far enough, antibiotics first came in, penicillin was a huge lifesaver, a very dramatic change. I've never seen a blood transfusion being given in the home, but if that was actually represented, if that was something that was dramatised on television, people would pick up on that. So you've got to know what your audience actually relates to.
And there are wider things that impact this as well. So obviously it's not big enough to talk about every factor that affects maternal mortality, but there are social things that are happening around this as well. There are better healthcare provision, there's probably more access to information about healthy food and healthy diets and things that might have impacted it.
The arrival of the NHS.
Massive thing, and it's really difficult to convey that in a display like this. So maybe risk is such a difficult factor to get across, we're always going to struggle in a museum display. I think it's a really interesting one to look at because all of our audiences react differently to it. Some of them love it, some of them quite scared by it and think it's very modern art, and some of them I think don't understand it, but it's always good to see how people interact with it.
Yeah, I suppose the thing is it at least provokes a reaction.
Yes, that's true.